To an Australian first being described as the medical equivalent of a man landing on the moon. A breast cancer survivor is pregnant after undergoing an ovarian tissue transplant. Diagnosed with cancer but desperately wanting a child, the woman went to Dr. Lynn Burmeister at Monash IVF, hoping to keep her chance of conceiving alive. In 2006, she had part of her ovary removed and frozen before starting cancer treatment. In April this year, it was transplanted back into her body. 4 months later, the ovary started functioning again, producing eggs. She underwent IVF and is now 6 weeks pregnant. And Dr. Lynn Burmeister joins us now from outside the hospital. Good morning to you. This is just wonderful news. Tell us, first of all, about this woman. When you first encountered her, what were her chances of actually falling pregnant?
Well, at that time, things were looking very dismal for her because she'd just been diagnosed with breast cancer. And back then, there'd only been a very few pregnancies in the world using this technology. So I didn't give her much hope of having a baby in the future. And the only hope was that the technology was going to improve. And here we see today, we're number 19 in the world. We're actually the number 2 in the world for a breast cancer survivor. So it's a great breakthrough for medicine and a great breakthrough for patients suffering from cancer.
It is extraordinary. It sounds very complex, Lynn.
Yep.
Extremely complex.
Well, it's actually not too complex, and so it's a very simple technique, and most gynecologists could actually perform the surgery that I performed. To take the tissue out, I just removed the tissue, doing it laparoscopically, so keyhole surgery. Then the embryologist took the tissue and cut the tissue up into tiny little pieces, 5 by 5 millimetres. And then when we went to put the tissue back, we put the tissue back into the ovary. We just opened up the ovary and sewed the little tiny pieces of tissue back into the middle of the ovary, and then oversewed the ovary. So it was actually a very simple procedure. And, you know, it's amazing. 4 months later, she had a natural menstruation, and then the month later, I'm collecting eggs from her.
Wow.
So it really, compared to some of my other IVF patients that I deal with, this was simple. And the fact she got pregnant on the first IVF round is just fabulous. It means that that ovary survived the freezing, you know, back when she was 37 to 44. So it's just amazing that the tissue could survive that long and be healthy. And I was just speaking to her the other day, and I said, once we have this baby, we're going to have another one. So she wants to have a couple of babies. Yeah.
Well, congratulations to you and all the team behind it.
So
we wish her
story.
The very best. She is wanting to remain anonymous, which everybody will respect. But in the meantime, Lynn, all the best, and I hope she goes well, travels well. Thanks for your time.